So you have an appointment with your specialist at the hospital, and it's the COVID-19 pandemic. What are you going to expect? My name is Dr. Hilsden. I'm a surgeon. I work out of London, Ontario, and patients may be a little unsure what exactly to expect when they arrive at a hospital to be taken care of during this COVID-19 pandemic. We're right near the end of the first wave, as people are calling it, and we're seeing declines in numbers. And services, both in our communities and in our hospitals, are starting to ramp up, slowly getting back to normal. And you might have an appointment to see a surgeon. You might have an appointment to see me. And we are now dealing with what everybody is calling truly the new normal. There's a change in how we approach taking care of people in the hospital, especially as an outpatient or on an elective basis. And you might be a little nervous as to what to expect when you arrive at the hospital. Being nervous to go to the hospital was a really interesting effect in the months of March and April. In fact, we had a dramatic decline in the number of people who would show up to the emergency department because they were genuinely concerned that by going to the hospital, they might get sick themselves. And that's a natural concern. Of course, now the numbers in our community are declining. It's safer than it's been to go and see your doctor, and it's so important that you do. But there are some precautions that are being placed upon us, both at the hospital and things that you should do as well. So first of all, what's it going to be like when you come to the hospital? Well, at our hospital in London, expect to go through a screening questionnaire. They're going to be asking about your recent health, possible exposures to COVID-19, any travel, and at any point, the screeners might flag you as being a higher risk patient. And it might be possible that you had an appointment you're waiting for your doctor, and that the decision might be made to say, you know what, now is not the right time for you to come to the hospital and see your specialist. And in fact, that happened to me earlier today. I had a patient who was scheduled to see me, unfortunately had some potential exposure to the virus, and we decided instead to actually address the problems on the telephone. And in this particular case, we were able to get all the information we needed, and it was still a good clinical encounter for this person. So it may actually happen that you show up to the hospital and you're not actually allowed to come in and have your appointment. Don't despair. Your doctor should reach out to you, and there should be an alternative arrangement made. Now, once you get in, what is going to happen? Well, if you're not wearing a mask already, and I encourage you to wear masks in the community, you should be given a mask because we want to minimize the chance that you'd spread a virus if you were to have it to other people, and that's what masks are doing. We encourage you, obviously, to wash your hands when you arrive at the hospital. Make sure they're nice and clean. Then, you'll go to your clinic waiting area. Now, this is where big changes have happened. In the past, we had rows of chairs where people would be sitting. Now, very specific rules about where people sit and how many people are in the waiting room are being applied. We're keeping that 6-foot rule, and we're recommending that that be extended to the clinical environment as well. After that, you'll be escorted to your clinical area where you'll wait for your doctor. Your doctor will likely be wearing a mask, and as was my practice before, I used to shake hands or try to have some physical contact with my patients. Now, in the COVID-19 pandemic, we're being extra careful. I'm minimizing the amount of physical interactions I have with my patients, not because I don't care. I appreciate just that hand-to-hand contact of a handshake just like anyone else. But now we need to really think about the transmission of the virus because I had to take care of many patients, and the last thing I'd want to do is spread the virus from one person to another. That would be a terrible shame. We try, in fact, to do other things to make our appointments more efficient. Your doctor might actually reach out to you ahead of time and do some of the consultation over the phone so that when you come to the hospital, it's only what has to be seen in person, like filling out certain forms or physical exam findings. One of the challenges we're facing right now is that the regular routine of booking operating rooms has changed. And so you can expect that you may not be as certain when your surgical date will be when you're done. So be patient with us, be patient with your doctors and the team as they figure out how we're going to be providing care going forward in the new normal of the COVID-19 pandemic. Thanks for listening. Please hit like, please subscribe. I've got lots of content about the healthcare system, about thinking, and various issues that come up from a medical perspective. Thank you.